Your advisory members, like your SHE officers, your occupational health nurse managers, your fire wardens, etc. These people cannot be so many that they exceed the number of health and safety reps. So, and remember also, these people that are nominated are not allowed to vote. So they cannot outnumber the number of safety reps on the committee. The committee by law must meet at least once every 3 months. So this is stipulated in the OHS Act, and the procedure at meetings must be determined by the committee. So the committee will have will develop a draft agenda. They will send it out to all the members. They will ask for input, comments, etc. They will then finalize the agenda. They will book a room. They will set a time and date. They will communicate all this to the members, and that's how the safety committees will occur. Remember, if a workplace feels that they need to have a meeting every month, they are welcome to do so. The Act only specifies that it must be at least, which is a minimum of once every 3 months. So some managers may prefer to have these meetings monthly. So I did mention that they may co-opt one or more persons by reason of their knowledge as an advisory member, but they're not entitled to vote. I did mention that management must be nominated by an employer. And why would it be important that management sit on these meetings? It's because management will be in a position to make important decisions, to influence important decisions, and a manager will have direct contact with let's say, for instance, a senior manager or a director, for him to place these recommendations on the table and request for something to be done in a situation that requires it. As I mentioned, meetings can take place as often as necessary, but once every 3 months. The minutes must be kept on file for a minimum of 3 years. This is also documented in one of the regulations. So the functions make recommendations to the employer, or where recommendations fail, to resolve the matter to an inspector. So what this essentially means is that the committee even has the power to go to an inspector if a situation or an issue at the workplace is not being resolved by the management of the workplace. Discuss any incident at the workplace or section thereof. So one of the items on the agenda is incidents reported and investigated. So any incidents that occur in your section, they must be brought to the committee and tabled there. So basically, a discussion of the incident will, number one, make all other safety reps and departments aware of what happened. It will also create this awareness will help people to maybe put processes in place in their respective departments so that nothing like this happens to them. So it's one of the functions of the committee to discuss incidents at the workplace. So remember, I said at the outset, everything must be documented. So any recommendation, any complaints, etc., must be documented. Therefore, the Health and Safety Committee minutes is so important. There must be somebody that can volunteer as a secretary or a chairperson to take minutes down. These minutes must be kept, as I said, for 3 years, a minimum, and they must be communicated to all employees. So in other words, it's not only the committee that sees these minutes. These minutes are discussed, but they must be communicated to every employee in the organization, so everyone knows what is going on in terms of health and safety at the workplace. Functions, again, okay. Here is also a committee cannot be held any civil liability against the committee. because in terms of the OSH Act, it is the CEO, as per Section 16, that is ultimately responsible and accountable for health and safety in the workplace. Okay, thank you so much, guys. I hope that this has added a little bit of value to you. But as Dr. Chin mentioned, when you undergo training, you get extensive training information, guidelines, etc., what your duties are, and how to go about doing this. Thank you so much for your attention and for joining us today.
Thank you very much, Michelle, for your time and sharing your experience and knowledge with us today. That's Michelle Morgan, that dealt with the roles and responsibilities of health and safety representatives and the health and safety committees. Michelle is the deputy manager at our SHE department. So our third presenter, dealing with the topic of risk assessment and incident investigation. That is the national manager of the SHE department, David Jones. And whilst David is preparing to share his slides with us, David, as I've mentioned, is based here at the NIOH, which is a specialized division of the NHLS, but is responsible for all employees within the NHLS boundaries, and that's throughout the country. And as I mentioned earlier, it's quite a large number of employees that is based in all of the laboratory and sites throughout the country. And in his position as National Manager of the Safety, Health and Environment Department, the SHE department, he brings with him a wealth of knowledge and experience, in particular 28 years of working in environmental and public health in the city of Johannesburg, and 12 years in safety, health and environment in the NHLS itself, with his duties including managing the implementation of occupational health information system, both in the NHLS and beyond. That includes neighboring countries where the OHS software is of great interest, including some of our provincial public health departments. David has qualifications in public health, the health service management, and a master's in public health, the occupational hygiene diploma. With no further ado, I'm going to hand you over to David. David, thank you for availing yourself out of your busy schedule.
Thanks, Ashraf. Everything fine?
Yes, I can hear you. Audio is perfect and your slides are maximized. Thanks.
Perfect. Thanks, Ashraf. Colleagues, I'm going to just be sharing on two topics: hazard identification and risk assessment, and then also incident reporting and investigation. I think there's a lot of maybe concern. People are a little bit worried about a risk assessment. What is a risk assessment? How do we identify hazards? And I'm hoping that I can just demystify this whole thing a little bit for everyone today. So let's start off with, why is a risk assessment important? What is this? What is it that's just going to very practically help you when you have a risk assessment? Firstly, a risk assessment is going to help to prevent workplace injuries and diseases. I really believe that a risk assessment document is the starting point of any occupational health and safety program, because unless you've identified risks that people are potentially exposed to, you cannot be proactive. So your risk assessment is also going to create awareness of hazards in the workplace. And we'll talk very briefly about the difference between a hazard and a risk in a moment. It will identify people who may be at risk of hazards. It will help to determine if existing controls are adequate. Every time there are risks, I believe that people put controls in place. The employer put controls in place, but are they adequate? It'll help to determine if a specific control program is required. Certain risks may require a very specific program. It'll help to prioritize hazards that need to be controlled. If there's a whole range of hazards, what should you be dealing with first? And of course, I put it at the bottom, but you might want to argue it might be at the top, legal requirements. The bottom line is, as Michelle has already indicated, risk assessment is a requirement of law by law. Let's just get some basic understanding. What is a danger? Danger is the possibility of suffering harm or injury. Included in harm or injury would be disease. The difference between a hazard and a risk. A hazard is anything that has the potential to cause harm to the health or safety of a person or property or cause equipment damage. So when we're talking about a hazard, it could be a condition, it could be a situation, it could be a practice, it could be a behavior. And it's not only harm to the health or safety of a person, but also property. What is a risk? A risk is the chance or the probability that this harm will actually occur under prevailing working conditions and the harmful consequence that may result. And I like to use the analogy of a knife, something very simple, something we're all familiar with. A knife has the potential to hurt someone. It's a hazard. If you've got a knife and you leave it on the desk, or if you leave it on the counter, it's got the potential to hurt someone. It's a hazard. But if the knife is just left on the table and no one goes near it, there's actually no risk of injury. The minute someone picks that knife up and they start to use it, there is an associated risk to using that knife. So what are some of the factors that would increase the risk? If the knife is very sharp, there's a greater risk that someone would get cut. If it's a big knife, as opposed to a very small knife, there's a risk that someone could get cut. If you're going to use the knife all day, there's a greater risk you're going to get cut than if you just pick it up and put it down again. And of course, someone who's been trained to use the knife and has the ability to use the knife safely is less likely to get cut than someone who's never been trained and has never been taught how to use the knife properly. So that is a very simple way of what is a hazard and what is a risk. Now, let's look at what a risk assessment is. Let's try and break down this thing which hovers over us, the risk assessment. Essentially, it's just a process. It's a process that results in a document. And the process involves in identifying hazards that have the potential to cause harm. You analyze and assess the risks associated with the hazards. In other words, look at the likelihood of harm, injury, or ill health. What is the probability that there's going to be a negative consequence, that there's a negative outcome? And then what is how great is the consequence of the potential outcome? We'll talk about that a little more down the road. And then also you determine ways to eliminate the hazards or control the risks when the hazards cannot be eliminated. And something has been said about that already, and we'll talk about it a little more as we go along through this section. Essentially, I like to think there's 9 steps to a risk assessment. And we'll talk about each of these steps briefly. Firstly, you need to identify the hazards the person may be exposed to. What are they? You need to identify employees who are potentially exposed and may be harmed, and how will they be harmed? 3, determine the risks associated with the activity. 4, consider existing controls and calculate the risk. We'll look at that as well. Prioritize your risks. Why would you prioritize your risks? We'll talk about that. Decide what more can be done to control the risks that you've identified. Record and implement your findings. Very important. You've got to have a document at the end of the day. Share the risk assessment and continue to monitor and review your documented risk assessment. We'll talk about each of those points. Firstly, hazard identification. Look at hazards which are encountered in the workplace. And broadly speaking, hazards have been divided into 5 broad categories. Firstly, physical. Secondly, chemical. Thirdly, biological. Fourthly, ergonomic. And fifthly, psychosocial hazards. And each of these hazards, I've included some examples, which would probably be common that you would need to include. Heat, cold, your temperature ranges. Is the person working in a very hot environment, very cold environment, a noisy environment, being exposed to a lot of vibration, ionizing and non-ionizing radiation, UV, X-rays? Think of hospital environments. Illumination, not enough light, too much light. Those would be your physical examples, and there are others. Chemicals, dust, toxic metals, solvents, pesticides, simple chemical products for cleaning, a broad range of chemicals that we would have to have a look at. Biological, a lot of people logged in today for the training are from hospitals. Your bacteria, your viruses, fungi, molds, but don't forget things like insects. Ergonomics, something which is becoming a greater and greater issue, something we need to give attention to. Body position, people who work at workstations, are they comfortable? Manual handling, lifting heavy items, straining the back, stretching, having to stretch for things, standing for long periods of time, awkward postures, repetitive movement, doing the same thing over and over in front of a piece of machinery. All of these could give rise to concerns. Psychosocial issues, something which is becoming a really big issue nowadays. And that would include shift work, stress, violence, travel, bullying, sexual harassment, racial or religious intolerance. And each of these you would include under the broad category of psychosocial. So you would look at hazards that are in the workplace. And here's just some examples for you to consider. Identifying those at risk. Look at who may be exposed and harmed by the hazards you've identified. Look at groups of people. Identify how they may be harmed. When you look at this, remember to consider special groups of people. And I've just lifted out a few. Expectant mothers. Moms who are breastfeeding might be at particular risk of certain things. People with disabilities. Don't forget cleaning staff. We think of maybe nurses and doctors working in a COVID ward. Don't forget cleaning staff that also go into the COVID ward. Remember visitors, members of the public. The Occupational Health and Safety Act says that we are responsible for every person who comes into our workplace, including visitors. But we are also responsible for people who are affected by our business, members of the public. So ask, have we missed anyone? Identify people at risk. Determine the risks. So what are the risks? You've got your hazards. What are the risks? Walk through the workplace. Look for the risks. Ask employees and others about work tasks and concerns. You know, nobody knows what risk people are exposed to better than those who are exposed to the risk themselves. A person sitting at an uncomfortable workstation is going to tell you very quickly, my back hurts when I work at my workstation. But some other useful things, injury and ill health records. You've got a record of any incident. You've got a record of accidents that have happened in the workplace. Look at those. That's a good starting point. Safety data sheets used to be known as material safety data sheets. Consult those. They will point out what risks are associated with your different cleaning products, your chemicals, etc. Consult manufacturer's instructions. Where a new piece of equipment is brought in, it will tell you clearly what guards need to be put in place and other control measures. Health and Safety Committee records, Michelle very clearly indicated that incidents are discussed at Health and Safety Committees. There's a record of incidents and accidents that have happened in the workplace and will help you to identify risks. Other health and safety professionals will be able to give input. Occupational medicine practitioners, occupational health practitioners, your nurses in the workplace, as well as occupational hygienists. And there are many others that you will be able to consult. consult broadly, consult widely. Then you need to try and score what your risk, how high the level of risk is. And that is simply done by looking at each risk and say, what is the likelihood of something happening and how bad would the consequence be? So let's just pick a very simple example. A lead cord over a passage. There's a possibility that someone will trip over it. What is the likelihood that someone would trip over it? Maybe you'll discuss it and say, we think there's a medium likelihood. What would the consequence be? You would discuss it, and maybe you would say, well, we think it's a medium consequence. Someone would fall. They're not going to die. They might sprain their ankle. So we think it's a medium consequence. And then if you look from medium likelihood and medium consequences, it would give you a score of 4. But take that same lead cord and put it across the top of a staircase. If someone was going to trip over it and fall down the stairs, what would the likelihood of them tripping? We'd maybe leave it at a medium, but what would the consequence be? It might have a very high consequence, because falling down the stairs could result in them breaking their neck and death. So that would then give it a score. So each of your risks, by looking at this matrix, you'll be able to allocate a score to that risk. And why would that be important? Because it's going to help you to be able to prioritize your risk. Identify what your greatest risk is and where you need to be focusing attention. But while you're focusing your greatest risk, look as well where you can get quick fixes. Where is it that we can sort things out as quickly as possible to be able to get quick results? Look at temporary versus permanent solutions. That lead cord in the passage, can't we rather, while we're waiting for the new plug to be put in, for the new piece of equipment, can't we rather take that lead cord and lead it over the wall and over the door so no one can trip over it? Look at long versus short-term projects and planning. Make sure that you put CapEx in place to deal with your risks, and perhaps even use your risk assessment to motivate for your CapEx. Look for what is reasonably practicable when you do your risk reduction. And Graham has already spoken extensively about reasonably practicable. Don't always focus on cost. Cost is a factor. Reasonably practicable includes cost. But I think you're going to have a very hard time trying to convince the Department of Employment and Labor we didn't have the money to do something when you were buying biscuits. So cost is important, but prioritize. Look at what is in place already. Are you meeting minimum legal requirements? Are you meeting industry good practice? And always consider moral and ethical responsibility, not just legal requirements. We have a legal requirement to look after our colleagues, but we also have a moral and an ethical responsibility. And when you are putting controls in place, I'm sure everyone's very familiar with the hierarchy of controls. Firstly, aim to eliminate. Try to completely get rid of that lead cord. If we can't eliminate, substitute. Try and get something that's an alternative. Get an engineering control, isolate people from the hazard, administrative controls, that is change the way people work, put policies in place, and PPE. And I think what's important is look at on the left-hand side of the screen. Your most effective would be to completely get rid of the risk. Now, the reality is, if you're working in a hospital in a COVID ward, it would be wonderful to say, we're going to get rid of COVID. But the reality is that we're not going to. The reality is we can't even always substitute, or we can't substitute for COVID. But we can put engineering controls in place. We can put people in isolation wards. We can put good ventilation in place. We can have good policies. But the least effective is PPE. But there are times when PPE is the only thing that we can do. And we have to do it. In fact, in terms of the hazardous biological agent regulations, for certain hazardous biological agents, PPE is a minimum requirement, and it's got to be done. So consider your hierarchy of controls. Just a quick checklist when you are drawing up your oops, let me go back. When you are drawing up your risk assessment document, make sure you've covered procedures and tasks. Make sure you've listed all your hazards. Make sure you've identified the groups of people who may be harmed, that you've listed the risks associated with the hazard. You've identified what controls are already in place. You've identified what more can be done to control the risk. You rate the remaining risk. We've done that: low, medium, high, very high. You've prioritized based on your rankings, and your actions have been identified and who has to take those actions. So you've said, this is what we need to do. You've allocated it to a person, and you've set a date when you want that action to be completed by. When the actions have been completed, you record it as well as the date. And that essentially is your documented risk assessment with all those. When you've got your documented risk assessment, make it available. It's not a secret document. It's something that must be made available. Make it available to other health and safety reps, your committee. Make it available to employees. Make it available to your employer. Make it available to the Department of Employment and Labor when they come and ask for it. Make sure you've got your documented risk assessment. Important, and Michelle has already touched on this, review your risk assessment at least every 2 years. You need to review your risk assessment anytime a process or a procedure and any materials have changed. Also, review your risk assessment after an accident or an incident. See if you need to tweak it, and on a regular basis to make sure that you've improved. Something that's hit all of our workplaces, COVID-19. I would hope that in the past year, all of our risk assessments have been updated to cater for COVID-19. The next section I want to touch on briefly is incident reporting and investigation. And essentially, I just want to run through on what incidents should be reported and why you should be reporting them. But before we start, what is an accident versus what is an incident? An accident would be an unplanned or uncontrolled, an unintended event giving rise to death, injury, ill health, or damage to property. As opposed to an incident would be an unplanned or uncontrolled event, which under different circumstances may result in an accident. Now, the Occupational Health and Safety Act and the legislation doesn't really differentiate between an accident and an incident. It talks about an incident. But another word for an incident would be a near miss, but as I say, or a near hit, the Act talks about incidents, which covers accidents as well. Root cause, Michelle has already spoken about that. It's the reason behind why an accident or incident occurred. The most basic cause, something that could be identified and which management has control over. Now, I think that picture is a good example of an accident. If the rock had fallen next to the car, it would be an incident or a near miss. What are the consequences of an accident or an incident? Firstly, injury, disease, death, damage to property, which can result in days of work and long-term health effects. But it can also give rise to inconvenience to both the employer and the employee. Reputational cost. It doesn't look good to an organization or an employee when you have incidents and accidents occurring all the time, and there will be reputational cost. Financial cost, that's self-explanatory, and also state supervision. You may have the Department of Employment and Labor coming in to see what's going on. Remember to consider health, not just safety, when it comes to accidents and incidents. A person called Frank Bird created a triangle, and he hypothesized that for every 600 incidents that take place where there was no visible injury, no illness, or no damage, for each of those 600, There were 30 incidents or accidents that resulted in property damage. There were 10 minor injuries or illnesses, and there was 1 serious or major injury or illnesses. Now, the reason I put this up is I really wanted to say that when it comes to reporting incidents and accidents, let's try and catch those incidents here. Let's try and beat them proactively before something happens that results in property damage, injury, whether serious or major. So why should we investigate an incident? Firstly, to establish the root cause. What is it that could have been done to prevent it? Because we want to prevent a similar incident in the future. The law requires that we investigate incidents. We need to fulfill the requirements of the law. It may be because we also want to process workers' compensation, and that we are not going to go into any detail today, but you can look at workers' compensation training that is available on the NIOH website, particularly around COVID-19, and then also to determine costs and losses. The Occupational Health and Safety Act 85 of 1993 stipulates when an incident by law has to be reported to the Department of Employment and Labor. And Section 24(1) A and B says that you've got to report to the Department of Labor when a person dies in the workplace, when it's a workplace-related accident that results in death, when a person becomes unconscious, when they suffer loss of a limb or part of a limb, when a person is injured or becomes ill or is likely to die or suffer permanent physical defect, if the person is unable to work for 14 days or longer because of a work-related incident, and when a major incident occurs. And that is defined further when lives are endangered by a dangerous substance spill, an uncontrolled release of a substance under pressure, flying, falling, or uncontrolled moving objects, and machinery that runs out of control. So who would you report this to? Well, you need to report it to the provincial director. How? The Act says by telephone, fax, I don't think there's too many faxes around anymore, or by similar means. So you could do it by email. And when? So you need to do it immediately. Of course, that you would have to complete WCL forms, your 1, your 2, there's your Annexure 1, and those you would need to submit as well, and those have to be done within 7 days. Section 24(2) talks about if someone dies, loses a limb, or is likely to die, you should not disturb the site where that happened. Obviously, this doesn't mean you don't move the person if they've been injured, but it also doesn't apply to a traffic accident on a public road, to an incident in a private household, or accidents in terms of the Aviation Act. Now, there's an interesting section in the General Administrative Regulations, which talks about an incident involving persons other than employees. So if someone's on your site and they're not an employee and something happens to them, you're required to notify, also by facsimile or similar process, to the Department of Employment and Labor Provincial Director. And you need to provide the name of the injured person, the address of the injured person, the name of the user, employer or self-employed person, the address of that same person, the telephone number, the name of the contact person, as well as details of the accident. What happened, where it happened, when it happened, how it happened, why, and the name of any witnesses. Beyond that, a medical practitioner who sees a person with an occupational disease should also report that disease within 14 days. There's also the right of any person to report a disease that they feel is occupation related to the employer and to the chief inspector in writing. Let's talk a little bit about recording and investigating. Who should do the investigation? Section 24 talks to that. Firstly, it is a person appointed by the employer. It should be the health and safety rep or a member of the health and safety committee. But you may also want to include other people, and that would be your technical experts, the user of machinery, the occupational medicine practitioner or your occupational health practitioner, as well as the section manager and a representative of labor. So which incidents should be investigated? Section 24 incidents, and we've spoken about those already. But in reality, any accident requiring more than first aid. My question is, why would we not investigate every incident so we can put a control in place and deal with the root cause before the incident becomes an accident? What is the process? When it's a Section 24 and it's got to be reported to labor, the employer has to appoint an investigator within 7 days. The recording, they need to record the findings on Annexure A. That is Annexure A in terms of the general administration regulations, and those are freely available on the internet. And at the back of the general administrative regulations, you will find Annexure A. That document and the investigation needs to be examined by the Health and Safety Committee. So Health and Safety Committee, you've got the right to have a look at that document. And the employer is required to implement the necessary actions to ensure this doesn't happen again, bearing in mind reasonably practicable. Remember, all the records have to be retained for a minimum of 3 years. And I'm going to wrap up now with just some final thoughts. What is it that we can take from this? And I like this little picture. We need to learn from incidents and accidents. Don't wait for accidents to happen. Be proactive. Know the risks in your workplace. Ensure controls are in place. Have a documented risk assessment. That is the beginning of any occupational health and safety program. Do regular inspections. Care for yourself. Care for your colleagues. We're dependent on each other. Thank you very much.
Thank you very much, David. That was David Jones talking to risk assessment and incident investigation and the importance of those particular processes and tools that we have in the workplace, and that you as health and safety functionaries, health and safety representatives and members of the health and safety committees can use to ensure that you have a complete picture of what are the hazards and what of those hazards poses real risks to your fellow employees and yourself, and what to do about that in terms of the mitigation and containment or preventative measures that is required. So just a quick admin thing. There are at least 1 to 3 people who's indicated that they have a colleague that have joined them because of some technical, I don't know, Wi-Fi or internet or bandwidth issue. So I'm going to ask Tsaimang Jacobs, please ask Motawane Motlaping to put together an official employer company attendance register signed with all your details, including signed by your manager, that you need to submit to us. That also applies to Lerato Mampati, who's with Zanele Totloana. If you could both do that official employer attendance register for us and email it to info@nih.ac.za, at NIOH.ac.za, info@NIOH.ac.za. And then finally, I think it's Peter Lachlocho, who is together with Ludwe Chabalala. He has joined Kolelane Osborne. Yeah, please, the attendance register. Having said that, I now need to introduce the final presenter for today, and that is Mashele Khole, who is the manager for waste assurance in the National Health Laboratory Services, based here in the SHE department within the NIOH, focusing on occupational health and safety matters as the Institute NIH. Mashele is an environmental health practitioner by profession with 20 years of work experience in environmental health and waste management. And with that very short introduction, I want to welcome Seshe. She's fondly known within the organization. I can see that your slides are about to be maximized, and we just need to check if your microphone is in a working order. So a quick reminder to everybody, visit our website, that is www.nih.ac.za. All of our resources are available on that website, and it is zero rated for all of the mobile service providers and I think one internet service provider. That means no data will be charged if you go to our website, www.nih.ac.za. So if you could maximize your slide for us and just check your microphone, I want to hand over to you.
Thank you, Ashraf. Good morning, colleagues. As it has been mentioned, my name is Mashela Sheshekhole. I'm the Manager Waste Assurance for the NHLS, and I'll be taking you through healthcare waste management in our healthcare facilities, how we should go about managing our waste. I hope you can see my slides.
Yes, we can. But if you could just click that little icon at the bottom that looks like a presentation screen, the very small one, the square
sorry.
on the, yeah, there we go. Oh,
Okay.
now we see your presenter slides as well. But please proceed in the meantime. I think there's another procedure to fix that. Okay,
then. Thank you. Okay, just a little bit of background in relation to healthcare waste. The World Health Organization tells us that of the waste that we generate in our healthcare facilities, 85% of it is general waste, and the remaining 15% is hazardous waste. And in South Africa, we have an information baseline report of 2012 that tells us that 1 to 3 kilograms of waste is generated by patients on a daily basis. Apologies for that.
No problem. While that is, oh, there we go. It's fixed.
All right. Thank you.
Please proceed.
Okay. Thanks. I was just saying that in South Africa, our waste information baseline report of 2012 tells us that each patient that is occupying a bed in hospital generates about 1 to 3 kilograms of waste per day. So you can calculate the number of beds that you have in your facility, and that will give you an idea of how much waste your patients generate per day, those who are admitted in hospital. And further to that, we also have the South African Waste Information Center, which records reports of volumes of waste that are being generated in the or treated in the country. So for more information, you can go to the environment.gov website, and you will learn more about the types of waste that we are handling in the country and the amounts that we are generating versus the amounts that we are treating. So what is this healthcare waste that we're talking about? This healthcare waste in our facilities is divided into general waste, which is waste mainly that poses minimum risk to human health and the environment. For an example, you have your office paper, your flowers, your magazines, food packages, food waste, and so on. But then this general waste excludes general waste that is being generated in isolation wards, because this waste is then managed as hazardous waste. And the second category of waste that we have in our facilities is hazardous waste. This is waste that is capable of causing harm to human health and to the environment. And it includes, for example, your electronic and electrical waste. This would be your desktop computers, your refrigerators, your cell phones, radios, laptops, and so on. And we also have pesticides in our facilities that we use to manage pests in our facilities. And thirdly, we have healthcare risk waste as a subcategory of hazardous waste that we generate in our healthcare facilities. This healthcare risk waste comprises of anatomical waste or anatomical or pathological waste, infectious non-anatomical waste, chemical waste, sharps waste, laboratory waste, pharmaceutical waste, radioactive waste, cytotoxic waste, and other waste streams. You should be asking yourself, why are we even talking about this today? Why is it necessary or important for us to manage healthcare waste? Firstly, is to avoid and or reduce the impact of this waste on the environment and human health. Mr. Jones mentioned earlier on about the hazards that we have in our workplaces and the risk that they impose on our health. We also need to manage this waste to ensure compliance with legislation. I'll get to that a little bit later. And we also need to manage this waste so that we can reduce the cost of managing healthcare waste, because it's quite expensive to manage the waste that we generate in our healthcare facilities, especially when it comes to hazardous waste. For instance, if you by mistake, you mix your general waste with a little bit of hazard waste, automatically that bin becomes hazardous waste, and therefore it must be managed as hazardous waste. So hence it is very important that we safely and legally manage the waste that we generate in our facilities. Okay, then let's talk about the health risks that healthcare waste poses on healthcare workers, patients, visitors, employees of waste management contractors, and the general public as a whole. These health risks are as a result of sharps inflicted injuries, toxic exposure to pharmaceutical products, exposure to infectious diseases, chemical burns arising in the context of disinfection, sterilization of waste or sterilization of waste treatment activities, and lastly, thermal injuries occurring during the operation of waste treatment technologies. So this list of the health risks that we have identified here is not exhaustive. There are other health risks that might arise from poor management of healthcare waste. We also mentioned the impact that this waste may have on the environment if it's poorly managed, and this would include the release of chemical substances into the environment if those substances are not handled, stored, and disposed in an environmentally sound manner. So you can't just leave your chemicals anywhere and anyhow and not manage them in line with the provisions of legislation to ensure that the waste that you've generated is safely handled from point of generation up to disposal. Secondly, with this waste may release heavy metals or materials with high metal content during incineration of waste. I mentioned that people who are also at risk are those who are handling waste off-site or those who are working in waste treatment facilities. So heavy metals, if you have heavy metals or materials with high metal content in your waste, and during incineration, these tend to release chemicals and other things into the atmosphere. This waste may lead to contamination of drinking, surface, and groundwater. If, for instance, your waste is wrongfully dumped in a landfill site or is wrongfully dumped by the side of the road, it may lead to contamination of our water sources. And lastly, we have air pollution arising as a result of the release of particulate matter during medical waste incineration as well. So we spoke earlier about the need to manage this waste to ensure compliance with legislation. So for us to manage our waste safely in the country, we have a few pieces of legislation that we need to adhere to. I'll just mention examples of the framework, legal framework that we work within in the managing our waste. We have the National Environmental Management Waste Act, which has its own regulations, and some of them includes the Waste Information Regulation, which talks to the National Waste Information System that I referred to earlier on about the figures or the volumes of waste that we generate. That information is collected under the national, or as required by the National Waste Information regulations. We have also registration of waste generators, and also there is a requirement for healthcare risk waste generators or hazardous waste generators in some provinces to register. For instance, in Western Cape, you are required to register and to report as a waste generator, regardless of whether you are a major generator, meaning you are generating in excess of 20 kilograms of waste per day, or you are a minor generator, meaning you are generating less than 20 kilograms of waste per day. We have the waste classification and management regulation as well, which talks to the waste manifest and record keeping of the waste that we are generating. A waste manifest system is mainly the control documents that we use when a service provider comes on site to collect your waste. They issue a first copy of the waste manifest, which is an indication or a document that confirms that this amount of waste and this number of containers, this type of waste has been removed from your facilities. And then once that waste is being treated and or disposed, you as a generator of waste would then receive another copy of the waste manifest, which is a proof of destruction or proof of disposal that indicates that your waste has been managed in line with the provisions of legislation. And now we also have the National Waste Management Strategy of 2020, which guides us on how we should manage our waste in the country. Other pieces of legislation include Air Quality Act, which is mainly on the standards for air emissions. When we incinerate our waste, we need to follow certain standards, whether it be in your healthcare facility or in an authorized healthcare risk waste treatment facility. There are standards for air emissions that you need to comply with. We have the National Water Act, which talks to the disposal of effluent into municipal sewers. So you can't just dispose anything into the municipal sewer. You need, the Act provides that you acquire a permit for them to allow you to dispose certain effluent into the municipality's sewer system. We also have the National Health Act, which has the national norms and standards for environmental health. And also this piece of legislation talks to the management of healthcare risk waste. Further to that, we have Occupational Health and Safety Act, of which a lot has been said about it earlier on. And another piece of legislation, if I may call it that, because now we have a SANS 10248 series, which has now been legalized or formalized in terms of we can use it in our facilities. It's a legislative tool now. Previously, it used to be a guideline document. But since we have it in the norms and standards for environmental health, now it's a document that we need to comply with. This document basically covers how we should manage healthcare risk waste in our healthcare facilities. So this list outlines exactly what is it that we need to be doing to ensure that we manage our waste safely. So for us to manage waste safely, we have a few principles that we need to, that guides us, or that we need to keep in mind all the time, which is duty of care principle, which basically says you as a generator of this waste, you are responsible for its ultimate fate. And from the point where you generate it up until whether it ends up at a landfill site or not, whether it will be there for the next 50 years, but you are still responsible. Therefore, that simply means that before you even generate your waste, you need to think of the consequences, or where will this waste end up. So even before you start with your activities, there are a few things that you need to take into consideration. What are the hazards that this waste is posing? What are the quantities of waste that I'm generating? How am I going to store it? How is it going to be disposed at, and at what cost? So all these things you have to take into consideration so that you can plan and put measures in place to ensure that you manage your waste safely. We have the precautionary principle as the second principle, which simply says you always have to assume that the waste that you generate is hazardous until it can be proven otherwise. The third one is the polluter pays principle, which simply says that the generator accepts complete financial liability. So you, as the generator of this waste, you are financially liable for its safe and legal handling, storage, transportation, treatment, and final disposal of waste. So you can't say I've generated waste, therefore it's somebody else's problem. It remains your problem financially as well. So this is a picture just to show some of the pictures that we have taken over the years of being involved in healthcare waste management. And these are some of the pictures that we took from different healthcare facilities, showing how waste was previously managed. So I hope that in your facilities, this is not how you are handling your waste. So how should we manage this waste that we just spoke about? General waste, for instance, there are simple things that we just need to follow. We just need to ensure that we avoid as much as possible generating this waste. We avoid generating waste as much as possible, or where we cannot avoid generating this waste, we reduce it. And where we can, we need to reuse some of the items that we are, this single-use items that we have become accustomed to, we need to just let go of them. We can recycle our waste, and this refers to materials that are recyclable. And as I mentioned, that the National Waste Management strategy that we have now speaks a lot about recycling of waste and the waste economy and so on. So we can go back and read that strategy just to familiarize ourselves with the intentions of our government when it comes to the waste that we are generating. You can compost, for instance, your food waste. You can have a garden in your facility and use that waste to create compost and use it in your garden. Where you cannot do this, then the waste can be treated. So we treat this waste to reduce its level of toxicity or to even reduce the amount of waste that we are generating. And as a last resort, you can dispose your waste, but let disposal be the last resort, especially when it comes to general waste that is not contaminated. The other waste category that we have is anatomical waste. So basically, how we manage this waste is that we need to make sure that, and this would apply to all the waste that we're generating in our facilities, we need to segregate this waste at point of generation. We need to separate this waste from other waste streams at the point of generation. Don't put everything in one bag or one container and at a later stage, then you start segregating it. So we need to do all this so that we can reduce the risk of exposure to diseases and injuries that we have talked to earlier on. So you need to make sure that your containers are clearly marked. You need to make sure that you don't fill your containers to more than the fill line. We can see that we have this fill line that we have here on the red bucket. So this is a guideline that shows us that our waste should not go beyond this fill line. And then you need to make sure that when you label your waste, you label it with the name of the facility, the date the container was first opened, the date that the container was last used, and if you have your waste generator number that you have received from, because you are a major generator in the other, in all the provinces, as a major generator, as I said, that you need to register as a major generator with the Department of Environment, Forestry and Fisheries. So they allocate you a number and you make use of that number on your containers. This number allows for the treatment facility to record under your service number that this is the amount of waste that we have handled from this facility, so that they can report that information to the relevant authorities. And lastly, you need to make sure that you store this waste in a dedicated storage area. You don't just store it anywhere. You don't leave it to the elements, but you have in your facilities areas that have been, or storage areas that have been allocated for the storage of healthcare risk waste. The same would apply to your chemical waste. So, but then when it comes to chemical waste, we know that we deal with solid, liquid, and gaseous chemicals. But for mixed liquid waste, for instance, where you find that it's part water, part blood, and part chemicals, it is advisable to use these cans. Like at the bottom, we have the drums, And then at least if they are clear drums, you are able to see the content that is inside the drum itself. You are able to see as the container is filling up that now these are the levels that I should not go beyond, or the levels that I should not exceed. And the blue drums that we have here are mainly used for storage, for collection and transportation of other chemicals, maybe that are solid or other liquid chemicals. Maybe you find that they are in small bottles, then you need to use these drums. But make sure that the containers that you are using for chemicals are compatible with the chemical that they contain. And another thing is that with chemicals, we need to make sure that we remove the original labels, or you deface the original label so that there's no confusion that this is waste. So, but then you need to make sure that they are still contained, they are still properly labeled, and when this waste is taken to the treatment facilities, is accompanied by the safety data sheets are also included, so that the treatment facility would know how to handle your waste. We also have non-anatomical infectious waste that would also follow the same requirements of segregating at the point of source, not filling beyond the fill line or above 3/4 of the container. And in the case of COVID waste, the guidelines that the Department of Health has put out is that COVID-19 waste needs to be clearly marked so that the treatment facility or the contractor knows that this is COVID waste. I need to prioritize it when it gets to my facility. We also have sharps waste, of which we use yellow containers for sharps waste, and it also follows the same labeling requirements, the same storage requirements, and the markings and all that needs to be on the container. Pharmaceutical waste is another waste streams that we deal with in healthcare facilities. We need to make sure that this waste cannot be tampered with. This waste cannot be accessed by anyone besides those who have been authorized to manage this waste. Okay, so this is my second last slide, just to share with you that to ensure that we manage our waste safely, we as generators, we have responsibilities, and some of these responsibilities includes avoiding generating the waste, as we mentioned, minimizing the waste that we generate, purchasing necessary materials will make sure, and in required quantities, will make sure that we avoid or we minimize the waste that we generate. You always need to go back and do your audit your stock frequently. Make sure that you first in, first out. You can use that process of first in, first out. You don't remain with a lot of stock that you will end up disposing at the end of the day. Where you have excess materials, share with your colleagues. Don't harbor things, don't hold on to your chemicals or reagents or whatever to a point where they expire and you don't know what to do with them, but to dispose them. You use materials for their intended use. We have seen practices over the years where for instance, the infectious waste boxes are being used to store other things other than what they were bought for. Because when we buy these containers, they come at a cost, so we just need to make sure that we use them for what they are intended for. Where we can reuse materials, where we can recycle, we need to make sure that we properly segregate and package at the beginning. We need to make sure that we properly store our waste, and internally, as in within our facilities, we are responsible for making sure that we safely and legally manage our waste. Last slide is that as a facility, you need to have a person who is either appointed or designated as healthcare waste management staff. They need to be people who are responsible for ensuring that from the point of generation up until to the final storage area, your waste is managed safely. You need to develop your healthcare waste management policy. This will guide you in the facilities on how to go about managing your waste. You also need to make sure that you have your occupational health and safety policies. You have your risk assessments that Mr. Jones spoke about. And this also you need to make sure that in your risk assessment, you also include those who handle waste in your facilities, or the process of managing waste in your facilities. It's very important to include it in your risk assessment. You also have to develop and adhere to your standard operating procedures, provide the correct PPE to those who are handling healthcare waste. And you also need to make sure that your staff is trained on how to manage this waste that they are generating. And as I mentioned earlier on, I spoke about the waste manifest document. These documents are one part of collecting information on the waste that you are generating. So you can have a file where you will put in all your waste manifest documents and any other waste management related documents that you might have. Maybe if you have your training certificates, you have all that, but you need to have documentation, because should there be an audit on your maybe an audit by the Department of Health or by health inspectors or the labor inspectors, you should be able to prove that the waste that you've generated on your site has been managed properly by whoever that you have contracted to handle your waste. You need to make sure, one other key thing is that you need to make sure that there's somebody, as I mentioned earlier on, that you need people who are responsible. They can be designated healthcare waste officers in your facilities, but somebody needs to monitor how this waste is managed so that we don't have this, we avoid these needle pricks, we avoid being exposed to different chemicals and so on in our facilities. We also need to monitor the removal and disposal of our waste. Whenever contractors come on our site to collect waste, somebody needs to be there to make sure that the waste that they are collecting is the correct waste. Otherwise, you will end up with either an invoice or a waste manifest that does not reflect exactly what is it that you gave over to them. And lastly, you need to make sure that the contractors that you put in place are solid contractors. And you need to make sure that they know and understand that the waste, the type of waste that they are handling, and you need to make sure that treatment facilities that your waste will end up at is an authorized treatment facility. It's not just a fly-by-night facility that is not known by anyone. And with that, colleagues, I thank you.
And I need to say thank you very much to Mashele Khole Sheshe, as he's known, the manager for waste assurance in the NHLS, based here in NIOH, responsible for the organization's national waste management program. Thank you very much for your contribution. And that's it. I think we've run out of time. I just need to remind those that is Motawane Motlapeng, who's with Tsiamang Jacobs, as well as Zanela Tutluana, who is with Lerato Mompati, and Kolelane, who is with Peter and Lodwe. And then there's the Department of Labor and Mpumalanga Group. Please, you all need to have an official company employer attendance register that you have all signed, and that attendance register is authorized at the bottom by a manager, and this needs to be emailed to info@nih.ac.za. That is info@nih.ac.za. And in that way, for those of you who've had to be together in small groups around a particular device or computer, will be able to be assisted with the attendance register. At this point, I need to say thank you very much to Dr. Tanusha Singh, who's the head of our NIH COVID-19 OHOD, that is the Occupational Health Outbreak Response Team, who opened our session today. And then David Jones's team, firstly, Dr. Graham Chin, who did the overview of the applicable legislation. Thank you very much, Graham, for your contributions, followed by Michelle Morgan, who dealt with the roles and responsibilities of health and safety representatives and committees. And David followed that with the risk assessment and incident investigation. And then finally, we've just heard from Mashele Khole, who dealt with the waste management topic. Thank you very much to all of our presenters, and thank you for taking the time to share with us your presentations in today's webinar. And on that note, I'm going to ask you to hold on as attendees so I can play that set of slides again with the contact details for us. Please, the website is www.nih.ac.za. That is ac.za. That is www.nioh.ac.za. Our website is zero rated, and you'll find a host of COVID-19 resources and the presentations of previous webinars, as well as the relevant information, health and safety resources linked to that. And that website is zero rated, as I've mentioned. Our YouTube channel, I've also posted in the chat box. It will be also on the slides that I will show in a moment, is where all of our full video recordings of our webinars are made available. And you can go and visit that, especially for those colleagues who couldn't join you today. And with that note, please, I have checked your chat box. There are a few people who have asked them for their email addresses because they've indicated that a colleague has joined them. The Mpumalanga Department of Labor Group has linked up with a mobile device which says, I think, Galaxy S20 Plus. Please, that colleague must put in an email address there, and the attendance register is going to show Galaxy S20 Plus if you do not change your name and surname while you are in the webinar. So on that note, thank you very much again for joining us for this topic, the general OHS COVID-19 training for health and safety representatives, also known as SHE representatives, and all of the other colleagues who play a key role, as Dr. Singh indicated earlier, within the health and safety functions and roles and responsibilities in their different capacities. Goodbye, and we'll see you on our next webinar. So I'm just opening those slides for you and sharing that with you in a moment.
you.